ActionSA is calling on the South African Human Rights Commission to step in to tackle a shortage of medication at public facilities in KwaZulu-Natal. It conducted fact-finding visits where it emerged that some have been waiting for months for life-saving medication. There's also a shortage of ambulances and staff are working under extreme pressure. Nobuhle Modise has more.
A crisis in numbers. ActionSA's oversight visits to hospitals and clinics across KwaZulu-Natal paint a dire picture. Empty pharmacy shelves, exhausted healthcare workers and patients left untreated. The party says it has no choice but to turn to the Human Rights Commission for intervention.
There's a beautiful facility in there for chronic medications called a CCMDD. And it's something that works beautifully where people come here, patients come here to collect their chronic medications. They don't have to go back to the hospital. But ever so often, every second person or other person that comes to collect medicines, in their packet, there's a slip that has been put in to say the medications are not complete. There's a missing medication. And the person that's in there just informs the patient that there's a missing medication, you got to go back to the hospital. Now, that's a massive inconvenience for the patient.
ActionSA says its visits to hospitals such as Eshowe Provincial, Benedictine and Osindisweni uncovered severe medication shortages with no clear plan to replenish stock. But that's not all. Staff shortages and a critical lack of ambulances in some districts are said to be further crippling the system.
The Minister of Finance will be giving budgets to the different ministries. Later, there'll be a health budget speech. And I want to be able to advocate for South Africans about the needs in our healthcare system. Now, when we have fellow politicians that are economical with the truth about the challenges on the ground, that creates a problem in terms of how we can intervene.
For patients, these shortages aren't just statistics. They are life and death. This patient, who wants to remain anonymous, relies on chronic medication. She says she hasn't been able to get her full prescription for weeks.
I've been coming here for the past 10 years. But the problem recently we are faced here at the KwaDuguza clinic is medication shortage. I collect normally 5 to 6 medication, but recently they said there's a shortage. And I come so far with the taxi just to collect 1 cholesterol medication and go back home. So when we ask them what's the problem that we didn't receive our normal medication or the quantity, they say that there is a shortage and then we'll have to go and purchase. Now that we are relying on government clinic, then we'll have to purchase and we'll have to pay our own taxi fares to come so far. I don't think that's fair.
ActionSA is also pushing for urgent hearings in Parliament.
This is a human rights issue. You know, while the MEC keep denying the problem we are facing, people will be dying. And if abantu actually meet a obviously the next step would be also shown.
For Newzroom Afrika on Channel 405, I'm Nobuhle Modise in KwaDuguza.